guys, today I want to share very quickly my update about my Kienbock's disease surgery treatment. So if you have followed my blog previously, I had basically a bone replacement. It was a graft taken from around here and put in the wrist to replace the crushed bone. If you need to know more details about the disease, please check out my previous material, but now just to give you a really quick update on what happened. So it has been 3 months since the surgery, and as you can see, my cast has been removed. It was actually removed about 6 weeks after the surgery, and I was put in this brace. It's like a removable brace. The bottom of it is solid, hard, and the top is soft. And it pretty much immobilizes your wrist completely. You can also choose the sort of, you can loosen it up or whatever, depending on what you're doing. For example, when you're like just sitting at home or sleeping, you can loosen it up a bit. And when you're like trying to lift something, for example, at the beginning, you can make it tight to make sure that you don't strain your wrist. So this has been really useful. It's nice because it's made of fabric, so it's breathable. It can be washed, which is awesome. I really recommend investing in this if you have any issues with your wrist whatsoever. Okay, so now a few words about my actual arm. I have now been back at the gym, lifting maybe about 1 kilo of a dumbbell in my hand, and sometimes I put additional ankle weights on my forearms. I just want to, for the record, say this is by no means medical advice. So if you're looking to work out and you have any issues or any injury or Kienbock's disease, please do not take this as expert advice. Please consult your doctor. I'm just telling you about what I've been doing, and my doctor has given me a thumbs up for this. So I have been working out bicep, tricep, shoulders very gently with using very small weights such as 1 kilo dumbbells or 2 kilos maximum. Of course, wearing this brace so the wrist does not make any movements, and it's usually just pushing or pulling exercises very gently for a high amount of reps, just to get this muscle tone back in and get my strength up. The strength has been decreased, but it's really not as bad as I expected, so I'm quite enthusiastic about that. Lastly, the scar. You can probably see the scar. The reason why it's kind of wavy, it's I've been told it's much easier to stitch up because the surgeon can see where the ups and downs are, so they can stitch it up evenly, and it makes it heal much nicer. So as you can see, 3 months post-op, this is quite a nice scar. Sometimes you can have an issue with the scar, which apparently I have had, where the scar tissue attaches itself to the layers of skin underneath it. So rather than being mobile together with the rest of the skin, it's kind of stuck to whatever's underneath, to this tissue that's underneath. So my physio has been working on this by massaging and trying to mobilize this, so it's really improved greatly. And I'm also using some special creams that have been recommended by the doctor for the scar. So again, this is not any sort of advice for you guys, it's just for reference, and if you're really curious what happens after surgery, and how this whole experience has looked for me, this is how it's been so far. So I haven't at any point really experienced any pain. I still have really reduced mobility. As you can see, this is the maximum range of movement that I can perform. So it's actually quite limited compared to the other wrist. This is it, and the other way. So this way is also quite limited. I am only 3 weeks into physio, and throughout the next 2 weeks, I'm going to be working hard on mobilizing the wrist fully. I'm still not able to lean on it. I'm still not able to push with it. And again, the physio said we will be working on fully mobilizing this wrist. And so far, the prognosis is pretty hopeful. Of course, when I strain myself too much, I do experience leg pain, but I would say the quality of life at this point is fairly good. Same with the scar. It's not really painful until, if you start rubbing harder in those spots where it's actually attached to the tissue, you can kind of feel like a sharp pain. So if you experience any sharp pains in your scar during movement or rubbing, you should also probably consult your doctor to help you work with that. because the older the scar, I've been told, the worse it is to mobilize it. So again, if you're experiencing any troubles or if you're curious about anything I've talked about, please talk to your doctor. And this is pretty much my update. And I will let you know how my physio had gone after it's finished. See how we can mobilize the wrist fully or maybe not. And the final outcome, I've been told, will not be evident until around like 3 months from now. So in total, it's at least 6 months required to tell if this graft has not shifted, if it's not, been misplaced, or if it's not, if it's actually developed proper blood circulation. So please, keep up with my updates if you're curious about the Kienbock's disease or, in fact, working out with any kinds of injuries. I think, I'm trying to provide some interesting details of my story, but please do not ever take this as medical advice. Thanks for listening, as always, and see you later.